This video will expand upon the form titled, "Are you serving a student who has a dual sensory loss or deafblindness?" The first question asks, what is dual sensory loss or deafblindness? Dual sensory loss or deafblindness is defined as the combination of vision and hearing loss, which causes communication, developmental, and educational needs that cannot be accommodated in special education programs solely designed for children with deafness or children with blindness. An individual is considered deafblind when that person has both vision and hearing loss, dual sensory loss, or has been diagnosed with a health condition that causes progressive loss of vision and/or hearing. The next question asks, does deafblind mean the person cannot see or hear? No. When most people hear the term deafblindness, they think of Helen Keller, who was totally blind and totally deaf. In reality, deafblindness does not always mean a total loss of vision and hearing. Most individuals with deafblindness have varying degrees of functional vision and hearing. The next question asks, can the student have other disabilities and still be identified as deafblind? Yes, the student can also be identified as having other disabilities, such as those listed below, such as health impairments, cognitive impairments, physical or orthopedic impairments, speech, communication, and/or language impairments, or other disabilities, such as autism and learning disabilities. The next question says, why identify students as having dual sensory loss or deafblindness? Appropriate identification of sensory loss can assist educational professionals in appropriately planning to meet the student's educational needs. Specially designed instruction might be needed. Adapted materials might also be needed. Corrective lenses and/or hearing aids might be needed. Related or supplemental services might be needed. For example, orientation and mobility, vision support services, hearing support services, American Sign Language, tactile sign language, or haptics may be needed. The following are some health conditions and events, including complications of childbirth, which may result in both a vision and hearing loss: congenital rubella, congenital syphilis, congenital toxoplasmosis, cytomegalovirus, fetal alcohol syndrome, hydrocephaly, maternal drug use, microcephaly, neonatal herpes simplex, asphyxia, direct eye and/or ear trauma, encephalitis, infections, meningitis, severe head injury, stroke, tumors, medicines, chemicals. Many syndromes have associated vision and hearing loss. A partial list of these syndromes includes Bardet-Biedl syndrome, Batten disease, Charge syndrome, Cockayne syndrome, Cornelia de Lange, Dandy-Walker syndrome, Down syndrome, Goldenar syndrome, herpes zoster, Leber congenital amaurosis, Marfan syndrome, monosomy 10p, NF1, Prader-Willi, Pierre-Robin syndrome, Treacher-Collins syndrome, trisomy 13, trisomy 18, NF2, Usher-1 syndrome, Waardenburg syndrome, Wildervanck syndrome, and Wolff-Hirschhorn syndrome. For more information, contact Natasha Babler, Deafblind Project Coordinator of the Missouri Deafblind Technical Assistance Project, at natasha.babler@msb.dese.mo.gov, or call 314 633 1587.